Physiotherapists are trained to assess, diagnose and treat people with a whole range of conditions. For patients in the workers' compensation system, often what we're treating is neck pain, back pain, knee pain, ankle pain, which are referred to as musculoskeletal conditions. During treatment, your physiotherapist will often provide you with strategies to use when your pain might be higher, and you might use those. They might be things like stretches. If you're very worried and you have a new pain or a different pain, it is worthwhile seeing your doctor or your physiotherapist earlier possibly than your next appointment. But mostly there are variations in pain as you're gradually improving, and you might just reduce your activity levels a little bit. You might use some ice or heat, depending on your advice, to help settle that period of pain down. Helping yourself recover when you've got chronic pain is very difficult. For many people, what helps is to talk with your doctors and your physiotherapist about whether your tissues are safe to load and whether it's safe to be active. Then think about starting a small amount of activity every day. Might be a short walk for 5 minutes or 10 minutes, and gradually increase that. It helps to just gradually increase activity. Remember, it's actually quite hard to re-injure yourself. It's very common to do an activity and for your pain to increase a bit afterwards, but it's quite uncommon to actually do further damage. If you're concerned about that, getting advice from a skilled physiotherapist can be helpful. So what we advise first off is not to panic. It's quite hard to do further damage. And most likely the increased pain you're experiencing is to do with your nervous system being more sensitised. So often the strategies you're being taught with your physiotherapist or a psychologist, they're going to work to help reduce that pain. So calming, pacing, you might find light stretching works. For some people, it's more of more using distraction. You might pat the cat or water the garden, do some light activity or talk to a friend. In chronic pain, these periods of sensitisation are often 1 to 2 hours long, and if you wait them out, the pain will start to settle back down again after a short period. My top tips for getting the most out of physiotherapy are to remember that most pain settles down. Remember to stay active. Your physio can guide you with this, and make sure you understand what is happening in your body.